Dr. Aditi Nerurkar, she is a physician at Harvard Medical School. Dr. Nerurkar, first of all, I want to talk about the Pfizer vaccine could be fully approved by the FDA as soon as September. Moderna just announced that it has applied for full approval. Do you think that will help convince some who've been hesitant to get the vaccine?
You know, Joe, I think that the FDA approval that we hope will be in place by Labor Day is going to be a game changer. We know that 30% of Americans who are unvaccinated are waiting for FDA approval to feel a sense of safety. We know that FDA approval doesn't actually change the safety profile, but it may make people feel psychologically safer to get the vaccine, and that is a win. It also, the FDA approval will mandate, will help organizations, universities, sporting venues, anything with large crowds. They can start mandating vaccines because of FDA approval. So we have all been pushing for this in the medical community and are eagerly anticipating that announcement.
As our Morgan Chesky reported earlier, the Surgeon General is now saying it's a realistic possibility we will need boosters. Moderna announced just this morning that its shot is 93% effective for up to 6 months, but people who got that shot may need a booster this winter. Public health officials have made it clear this might be a possibility as time goes on, but still, does it present a challenge when Americans hear for many months you don't need a booster and then maybe the guidance changes?
Joe, the challenge is that with COVID and the data that is being presented with the vaccines, it is happening in real time. So we're actually studying the cohort of 40,000 people month to month and seeing if there is a change. A few weeks ago, the Pfizer CEO made an announcement that we may need boosters. Now, Moderna is saying that that could possibly happen. The CDC, Surgeon General, and WHO at this point are all aligned, saying that boosters are not indicated at this time. But like you said, for immunocompromised people, for elderly, that may change in the near future. And we're thinking that very soon in the coming weeks, there might be an announcement of boosters for those particular populations.
We're learning this is definitely a fluid situation. Doctor, while we have you, Morgan also had the story of a girl who ended up in the hospital with COVID. What would you tell parents who haven't been vaccinated, especially with children that are just too young to get the shot themselves?
Joe, this is probably the most concerning trend coming out of the Delta variant. The American Academy of Pediatrics just last week put out a report that there's been an 84% increase in 1 week alone of pediatric hospitalizations. That's a 5-fold increase. And we know that these are not uniformly distributed around the country. Areas with the largest amount of kids in the hospital from COVID are areas that correspond to the lowest adult vaccination rate. So there's a very clear indicator that when we vaccinate a large proportion of adults in a community, the kids are protected, especially children who can't get vaccinated.
And so important now as kids head back to school. All right, Dr. Nerurkar, as always, thank you so much. Appreciate your time and expertise.